Case number 10. A 52-year-old female came with generalized lymphadenopathy. Cervical lymph node biopsy was taken. Lymph node shows complete effacement of the architecture by neoplastic follicles. That is a follicular growth pattern. It shows apparent follicles that involve the cortex and medulla of the lymph node equally. The neoplastic follicles are oval to round, are evenly spaced, and show little size variation. The follicles show perifollicular retraction, so-called cracking artifact. The neoplastic follicles contain ill-defined germinal centers and are surrounded by poorly circumscribed mantle zones. Interfollicular areas are composed of predominantly small lymphocytes that include reactive T lymphocytes and a variable number of neoplastic lymphocytes. The follicles are composed of a mixture of centrocytes, small cleaved lymphocytes, and centroplasts, large non-cleaved cells. Centrocytes have hyperchromatic nuclei with irregular or cleaved nuclear contours. Centroblasts have vesicular nuclei and 2 to 3 small nucleoli. Some centrocytes become vacuolated. The follicles are composed of a mixture of centrocytes, small cleaved lymphocytes, and centroblasts, large non-cleaved cells. Centrocytes have hyperchromatic nuclei with irregular or cleaved nuclear contours. Centroblasts have vesicular nuclei and 2 to 3 small nucleoli. The neoplastic growth demonstrate grade 3A, which have more than 15 centroblasts per high power field. It is admixed with centrocytes. Mitotic figures and histiocytes with tangible bodies are demonstrated. The neoplastic growth demonstrates grade 3A, which have more than 15 centroplasts per high power field. It is admixed with centrocytes. Infrequent mitotic figures could be seen. Immunohistochemistry. CD20 is a B cell marker and shows membranous and cytoplasmic expression. CD20 highlights the majority of lymphocytes of lymphoid follicles and scattered small lymphocytes in the interfollicular region. The distribution of B lymphocytes in the interfollicular region is not sufficient to qualify as a diffuse pattern. CD79A is a B cell marker and shows membranous and cytoplasmic expression. CD79A highlights the majority of lymphocytes of lymphoid follicles and scattered small lymphocytes in the interfollicular region. The distribution of B lymphocytes in the interfollicular region is not sufficient to qualify as a diffuse pattern. The neoplastic follicles demonstrate a strong positivity for BCL2 nuclear membrane and cytoplasmic staining pattern. BCL2 is an anti-apoptotic protein that is BCL2 overexpression increases lifespan of B cells. BCL2 highlights the majority of lymphocytes of the neoplastic follicles. The neoplastic follicles demonstrate a strong nuclear positivity for BCL6. BCL6 is a marker of germinal center differentiation. BCL6 highlights the neoplastic follicles. Note that scattered small lymphocytes are positive for BCL6 in the interfollicular region. The neoplastic cells demonstrate a strong diffuse nuclear positivity for Ki67, marker of cell proliferation. The neoplasm exhibits a high proliferation index, with approximately 60% of lymphocytes expressing Ki67. CD3 highlights reactive T lymphocytes, which are concentrated around the neoplastic follicles. Small T lymphocytes are also seen in lesser amounts in the germinal center, mantle zone, and in interfollicular regions. Immunohistochemical studies contribute to highlighting the presence of neoplastic follicles. CD21 highlights follicular dendritic cell meshworks within the neoplastic follicles. Meshworks are preserved with occasional disruption and confluence. Okay, what is the diagnosis? It is follicular lymphoma grade 3A. WHO grading of follicular lymphoma. Grading of follicular lymphoma is based on the number of centroblasts per high power field of the average count of 10 neoplastic follicles. Grade 1 follicular lymphomas have fewer than 6 centroblasts. Grade 2 follicular lymphomas have 6 to 15 centroblasts. Grade 3 follicular lymphomas have more than 15 centroblasts per high power field. Follicular lymphoma grade 3 is subdivided as 3A and 3B based on the presence or absence of admixed centrocytes. Because of clinical outcomes, currently grade 1 and grade 2 are lumped under a low-grade category. When there are diffuse areas with equals or more than 15 centroblasts per high-power field, a diagnosis of diffuse large B-cell lymphoma is rendered. Okay, let's talk about follicular lymphoma. General background. Follicular lymphoma is a neoplasm of germinal center mature B cells that usually displays a follicular growth pattern. It is one of the most common lymphomas in the Western Hemisphere. Patients are usually elderly and present with generalized lymphadenopathy, frequent extranodal disease, and bone marrow involvement. Approximately 50% of patients with follicular lymphoma have bone marrow involvement. The neoplastic cells have a tendency to involve the bone marrow in a paratrabecular pattern, often associated with other patterns of involvement. T1418, Q32, Q21 is considered the molecular hallmark of follicular lymphoma. The clinical course is usually indolent. Approximately 5 to 10% of patients with follicular lymphoma develops a leukemic phase. About 30% of patients with follicular lymphoma transform to a high-grade lymphoma, usually diffuse large B-cell lymphoma. Thank you.